Hi, this is Alicia Lapardo. I am giving a presentation on heroin and understanding the epidemic. Heroin is a highly addictive opioid drug derived from morphine. It comes from a white brownish powder that is black and sticky, known as black tar heroin. It can be injected, smoked, snorted, or injected. Heroin works by binding to opioid receptors in the brain, leading to an intense feeling of euphoria and relaxation. Heroin use in the United States. In 2019, approximately 0.6% of the population's ages 12 or older had used heroin in the past year. Over 70% of the opioid overdose deaths involved heroin. And the CDC is reporting that in 2022, about 7% of the opioid overdose fatalities involved heroin, which 90% of those were linked to synthetic opioids, particularly illicit manufactured, what we call fentanyl. And heroin has largely been replaced by fentanyl in the illegal drug market and has most of its heroin availability in the United States is now mixed with fentanyl. Heroin also disproportionately affects people ages 18 to 44, people with lower socioeconomic backgrounds, those with limited healthcare access. Nearly 158,000 people died from heroin overdose during 1999 to 2022. So it's a lot. The impacts of heroin in the body. So the short-term effects are euphoria, dry mouth, heavy limbs, nausea, vomiting, slow heart rate, and breathing. Some long-term effects include chronic constipation, liver and kidney damage, cognitive impairment, increased risk of infection and disease, such as hepatitis and HIV from the use of needles. The effects of heroin in the body. Heroin, when it enters the body, it converts into morphine and binds the opioid receptor in the brain, causing an intense rush that varies depending on the dose and the speed of absorption. The immediate effects, the person will feel like a rush of warm skin, flushing, dry mouth, heaviness of the limbs. Some people might experience nausea, vomiting, and severe itching. The aftermath of use, following the initial effects, users become drowsy for hours with mental fog, slowed heart rate, and the most dangerous effect of slowed breathing, which can be life-threatening, that can cause a coma or brain damage. However, we do have Narcan, so we'll talk more about that a little later to help reverse those effects, or help stop those things from happening. How opioid affects the brain and nervous system. The breathing. Opioids affect the brainstem, which controls the vital function like breathing and heart rate, potentially leading to respiration depression. Emotions and behavior. The limbic system is altered, reinforcing drug taking behavior by influencing emotions, and pain relief. The opioids block pain signals through the spinal cord, providing pain relief. The cycles of heroin addiction. Experimentation is the initial use usually, or prescription opioid misuse leads to first heroin use. Tolerance and dependence. The body becomes tolerant and physically dependent, requiring more heroin for the same effect. And addiction and withdrawal. Compulsivity leads to addiction. And some of the signs recognizing heroin addiction: track marks, weight loss, poor hygiene, constricted pupils, behavioral signs, secretive behavior, financial problems, legal issues, neglecting responsibilities, things like that. Overdose, heroin overdose is a growing crisis. Some of the signs that you can see for heroin overdose: slowed breathing, unresponsive blue lips or nails. Overdose deaths for heroin continue to rise across the U.S. What to do in case of an overdose? You want to administer naloxone if you have it and call 911, or if you don't have naloxone, then just call 911. Treatment and recovery options: detoxification, medical detoxification under supervision to manage withdrawal symptoms. Medications like methadone and buprenorphine can help reduce cravings. Therapies, including cognitive behavioral therapies, group therapies, and joining Narcotics Anonymous. Naloxone saves lives. It's a medication that can reverse the effects of heroin overdose by blocking opioid receptors in the brain. Naloxone is widely distributed to first responders, healthcare providers, and community organizations. Preventing heroin use and addiction. You want to educate the public and public campaigns about the dangers of heroin, and the healthcare initiatives improve screening, prescribing practices for opioids, including and to prevent. These are the references. Thank you for listening.